So we surveyed NHS leaders, and the vast majority want us to be careful about the way in which we try to move from pandemic back to normality. So 8 out of 10 NHS leaders would like to see the continuation of free tests. 9 out of 10 want free tests for care staff. We don't want to see the end of mandatory isolation if you've had a positive test. We've got down to 5 days now, but we still think it's important that people do isolate. And we want the continuation of wearing masks in care settings. And we want the government to continue to undertake regular research about the level of prevalence of COVID out in the community. So our view is let's continue on an evidence-based incremental way to move from the pandemic to a situation where we are living with COVID, but let's not act in a way which non-necessarily increases risks or that means that COVID goes on for longer than it needs to go on for.
Has there been any suggestion that free testing will end for healthcare workers?
Well, we don't know. It's been briefed this week. We won't know the government's position until Monday. And so that's why we asked our leaders this week in order to get a strong message to the government ahead of that announcement. And what we're saying is that it would be a mistake to end free testing, and a particular mistake to end free testing for health service staff. We have to remember that whilst we're in a much, much better position than we've been in before because of the vaccine and because we have much better treatments now for people with COVID, it's still the case that many people are getting sick with this disease and that some people are dying with this disease, and particularly those people who are vulnerable, it is still a big issue. So let's move gradually to where we need to get to, and let's allow the NHS to focus on what it's starting to do, which is working at that huge backlog that built up during COVID.
Remaining careful, of course. I wonder if the question was asked, Matthew Taylor, as to at which point NHS leaders want to see some more normality in the healthcare system.
So I think we want to just take this step by step. I think what worries us is the idea that on Monday there'll be a kind of big bang, and at the same time, we'll do a whole range of things, each of which on their own could increase risk. So if on Monday we were to see no more masks being required in clinical settings, no more free tests, potentially downgrading the quality of real-time research that we have on COVID, put all of that together, all those issues together, and there's a real danger that we'll see an uptick in this virus at a time when what we want to do is we want to focus on the kind of day-to-day work of the health service. So, you know, we in the NHS are as in favour of everybody else of getting back to normal. A few weeks ago, we welcomed the reduction in the time period for people being isolated. But let's be evidence-based. Let's do this step by step. What we don't want is to see a set of announcements that look great on the day, but that we come to regret in the weeks and months to come. And let's not forget, there are still risks. The combination of declining immunity and the possibility of a new variant that could mean that the infrastructure we built around COVID will have to be used again.
Okay, Matthew Taylor, the Chief Exec of the NHS Confederation. We'll wait announcement on Monday, and I'm sure we'll speak to you again once we hear it. Thank you very much for being with us this morning.